And this presentation, it's counting towards my final for one of my classes. So Robin's gonna be recording. So if you don't wanna be recorded, you can sit behind her or don't raise your hand or whatever. So this presentation is on emergency childbirth. So whether you're pregnant and you are in labor and you find out you don't have time to get to a hospital or wherever you're planning to have your baby, or if a neighbor or a friend or your sister is in labor and can't get to wherever they were gonna be to have a baby, here's the basics of how you can help the person or help yourself. Okay, so just brainstorm, shout them out. What are some things that might prevent you from not making it to your birthing destination?
Car breaks down.
Car trouble, definitely.
Natural disasters.
Yes, California, earthquakes. It's been raining a lot. There might be some flooded roads. Might be a lot of road closures. What else?
No one to take you and lots of kids.
That would be very difficult. You don't want to drive yourself to the hospital and take along all your kids with you. That might be worse than just staying at home. What else?
Baby comes way faster than you expected.
Yes, we all know somebody that happened to. I know with natural disasters again, or not, it's not natural disaster, but terrorist attacks. I know during 9/11, a lot of laboring women were turned away from the hospitals because hospitals needed to help other people that were in more serious conditions than having a baby. So, if you find yourself in a situation where you are in labor and you know you can't get to a hospital, here's some tips or how to help somebody. So if you want to prepare an emergency birth kit, or even just, on the fly, if you need to grab a few things, here's what you're really gonna need. The most important things you're gonna need are scissors and a sanitized type of string or thread. So what I have, it's 2 shoestrings, and to sanitize it, you just boil it in water for 10 minutes. But if you don't prepare ahead of time, you can use floss, which is usually very sanitary. Don't use dirty shoestrings. It's not a big deal. If you don't have a string, you can just leave it attached and wait. It's not any type of brush. You also really are gonna wanna have a blanket for baby, blanket for mom, and some type of waterproof barrier for when you have the baby, unless you just have the baby in the tub, then you won't need this. So you can get like a shower curtain at the dollar store. This is a tablecloth, anything of the sort. If you bleed, you're gonna want to have alcohol or some type of cleansing agent to wash your hands. It's gonna have hand sanitizer or just soap. Gloves, you're gonna want some gloves. I've got a few different pain medications, some pads, a bowl. There's some garbage bags, there's 4 of them. Some more blankets, and baby wipes, and scissors. Okay, so if you think you're in labor and you find out, I'm not gonna make it to the hospital, don't panic. It's not gonna help anybody. It's definitely not gonna help you. So just remain calm. The first thing that you wanna do is call for help. So call whoever it is that was gonna assist you during your birth. Your doctor, your midwife. If you have a doula, call that person. Call your mom, anybody that can be there to help you. Then call 911, and 911 operators are actually trained to know how to walk you through labor, so put them on the speakerphone, they'll be able to assist you. And then unlock your doors so that whoever is the first responder can get into your home. If you're in labor, it's not very easy to just get up and go in through the door. So unlock the door as soon as you can for anybody that can assist you when they get there. And then last, just call anybody on your contact list. And don't discount your other children. Even if your children are young as 4, they can still be very helpful to you. They can run and get you your phone, they can run and get you a blanket. So involve your children, ask them to help you, let them know briefly what's happening and that you're gonna want their help. And make sure they don't freak out either. They need to remain calm. So then after that, after you've called your emergency list, go get your stuff that you think you're gonna need, and then go somewhere that you feel comfortable, somewhere that you feel safe. So if if the reason you can't get to the hospital is because of a natural disaster, so if it's like a tornado, go to a closet, go to a basement, somewhere that you know you're gonna be safe, somewhere that you feel safe, because if you don't feel safe, it's gonna inhibit labor and it's gonna make it more painful and more difficult for you to have your baby. So make sure you feel safe, even if it's your closet, your bed, the shower, doesn't matter, just make sure you feel safe. Okay, now if you're helping somebody, your neighbor comes knocking on your door, I'm in labor, I can't get to the hospital, don't freak out. I like to tell my clients, if you were gonna run a marathon and you told your friend, I'm gonna run a marathon, and your friend said, oh, no, don't do that. You're gonna trip, you're gonna break your leg, you're gonna twist your ankle, that's a horrible idea, don't do it. So if your neighbor comes to you and says, I'm in labor, don't go, oh my gosh, this is terrible, I've never delivered a baby before. That's not gonna help her. Just remain calm. Great, let's go have a baby, let's go back to your house and get comfortable. So once you get the woman situated, try to clean up the area as much as you can. Get some birthing items. If she has a birthing kit, grab that, or just the basic items that you know you'll need. Take care of, if there's any pets, lock them in the room, or maybe she doesn't care if they're running around. Just make sure that it's all good. And then get 2 towels, and just to have them ready, there's gonna be lots of fluids from many places that you're gonna want some towels to soak some stuff up. Okay, next. So during labor, the first stage of labor is the cervix is opening, and this can go really fast sometimes. Sometimes it can take several hours, sometimes it can even last days. So don't need to rush anything. Second stage of labor is when the cervix is completely open and the mother will begin to push, and you can know that the mother has reached this point by her sounds. If she's grunting, then you know that the baby is right there. She might even say some things like, I feel like I'm gonna poop a watermelon, or I really need to go to the bathroom. It's probably just the baby's head that is right there. And you don't need to check the cervix, you don't need to check the mother's dilation or anything. You know, that's really common in hospitals, but it's not necessary. You don't have to do that. So don't worry about it, you know, making sure that she's ready or whatever. Just let her do it and she'll let you know that she's ready. And another thing, if you don't have gloves and if you're gonna be using hand sanitation to make sure that your hands are clean, make sure that your hands are dry before you touch her or her baby, because if they're still wet and if you touch her, it's gonna burn. And if you touch the baby, it will just dry out the skin and it's just not very nice. So make sure your hands are really dry if you use hand sanitation. Okay, does anybody have any questions? Am I talking too fast?
Nope,
You're
very good.
Okay. So during birth, so once the baby's head is born, make sure the mother's okay. You can ask the mother if it's all right if you gently feel around the baby's neck to make sure that the cord's not wrapped. So we have our lovely model. So if the cord is wrapped around the baby's neck, you're just gonna feel inside with your fingers, and if you feel the cord, you can either push the cord down over the baby's shoulders. This cord's kind of short. You can push it down over the baby's shoulders, and then the baby can be born that way. Or if it's not too tight, you can lift it over the baby's head. You wanna make sure that you don't pull too hard on the cord, because although they are strong, they can break. You wouldn't want that to happen. So just gently feel around to see if it's wrapped, and then just untangle it either through the shoulders or over the head. And if the baby's head, most of the time, most babies, the head is the biggest part of their body. So after the baby's head come out, if the baby doesn't just slip right out right away, or if on the next contraction, or if she says she feels like the baby's stuck, you can just turn the baby's head to look at the side, and it will naturally turn the baby's shoulders, and then this direction, it will be easier for the baby to slip out that way. If that doesn't work, you can ask the mother to change positions. You can have her stand up, lay on her side, hands and knees. Don't be afraid to try lots of things. Okay, I think that's all for this.
When do you check for the cord?
As soon as the baby's head comes out.
Once it's out.
Yeah, once the baby's head is out, ask the mother if you can feel around. So be sure to ask the mom, you know, can I check? And then just feel for the cord. It's gonna be really slippery, but you'll know it's a cord.
What if like you can't move it though if it's stuck?
If it's too tight, I would say do it over the shoulders, cause that would be less than doing it all the way over the head.
So just kind of
But-
push it back in.
Yeah, push it back behind the baby's shoulders as much as you can. And even turning the baby, like if you turn the baby's head at that point and then the shoulders will rotate, it'll give you more room to reach for the cord. Good questions. Okay. Oh, wait. I looked it too soon. Okay, breech babies. So, if you see the mother's laboring, if you haven't like looked down to see what's happening, if she's struggling, ask the mom, is it okay if I look? Let's, see if we can see what's going on. So you might see the baby's feet first, or you might see their bottom first. Both are different types of breech positions. So if that's the case, you're gonna wanna have the mother scoot her, if she's laying on the bed, have her scoot all the way to the edge of the bed so that her bottom and her legs are hanging off the bed, and you can support her legs if she wants that. Or she could squat, or hands and feet. And it's very, very important that if this happens, you don't touch the baby. You don't wanna pull the baby out. The baby needs to be born all by itself. So as the bottom and the feet come out, don't touch the baby, just let the baby do it by itself. And then once the baby's entire body will be out, it'll be hanging from its head. And it might look kind of scary, you might be really worried, but don't worry, just let the baby do its thing. So the baby's body weight is gonna be creating gravity for the head to come out by itself. So then once the head starts to slip out, grab the baby under its arms, and then you can catch the baby and hand it to mom. I think that was all for breech. Do you guys have questions about that one?
That seems so simple since they make such a big deal about breech
I know.
babies.
Well, it can be dangerous, but in this type of situation,
You're already being.
yeah, you're already in an
You're already
emergency
living on
type of
the edge.
situation. So the best thing to do is just to let the baby and the mom do it by themselves. Okay. Birth. Okay, so when the baby's born, it's gonna be covered in this white type of substance. It's called vernix, and it's gonna be a whitish, creamy yellow color. And this is very good for baby. It's nourishing to the skin. If you see that it has kind of like a greenish color or even black, that means that the baby has pooped, and it's called meconium. So it used to be very protocol, I guess, that when the baby was born and they had meconium, and you guys have probably seen this on TV, they would take the bulb syringe and they'd suction their nose and their mouth immediately when they were born. Well, that's not protocol anymore, even for doctors. So as soon as the baby's born, if you notice that they have pooped, if there's meconium, just take a towel and just wipe the baby's face gently, and that's all you have to do. And then if you notice, if you feel like the baby is choking, if they do have stuff in their lungs, then that's the time that you want to use the bulb syringe to suction it. You guys have questions on that one? Okay. So, cutting the cord. This is really important. That's why it has its very own slide. So, every movie I've ever seen of a baby being born, baby comes out, the doctor cuts the cord. This is not something that you have to rush. In fact, it's better if you take your time. There, you can see in that picture with the baby that has its placenta still connected. That's actually a tradition called a lotus birth. Thank you. And it's totally safe. You don't have to cut the placenta off. Most people do because it's convenient, and it's just annoying to have to carry around. But it's not anything that needs to be rushed. So in that picture in the middle, you can see this is what the umbilical cord is going to look like as soon as the baby comes out. It's going to be really dark and full of blood. And after the baby's born, the placenta is still holding up to 1/3 of the baby's blood. And this is really good oxygen-rich blood. And so even when the baby's born, if they're not breathing right away, they are still getting lots of oxygen from the blood and the placenta. So you don't need to rush cutting the cord. Let the cord, you'll even be able to see it pulsing, like a heartbeat. You'll be able to see that happening. And then this picture on this very left, see how it's white? This is the umbilical cord after all the blood has drained from the placenta. Might take 5 minutes, might take an hour. No need to rush, just let it go however you feel comfortable. So then when you feel ready to cut the placenta, you're gonna get your sanitary type string. You're gonna tie one close to the baby. It really doesn't matter where you tie it, but you know, it's just convenient if this isn't 10 inches long. So you'll tie one side on the baby, one side on the mama, and the placenta might still be inside the mother. It might already be born. Either way, it doesn't really matter. So you'll tie it in 2 spots, and then you'll just cut in the middle. Okay, any questions?
If you don't tie it, does it hurt? Or does it just keep the blood flow or something?
It does not hurt.
Yeah, it doesn't hurt for
Well,
sure. I think
Okay.
the reason that you tie it is because it's cleaner.
Okay.
I know umbilical cords can leak from the baby side, but I don't know. Samurai, did you have input?
There's blood, like, often there's just blood left in both
Yeah,
sides, and
it's
so
bleed.
tying it off just stops the blood from flowing,
Okay.
and will help it to cinch closed faster.
Right. Okay, thanks. I meant to look that up, but I forgot. Okay, so once the baby's born, if the cord's long enough, if the baby's still attached to the cord, and the baby to mama, it's good to have them both skin to skin, so the mom will be topless. That'll encourage warmth for the baby a lot more than if she has a shirt on. But either way, it doesn't matter. Just have her hold the baby closely to keep the baby warm. Then take a blanket, put a blanket over both of them. If you feel like the baby needs help to breathe, and you've already wiped their face, you've already suctioned, you can hold the baby like this, kind of like at an angle, and just rub their, or even if the baby's still laying on the mom, that's fine. Just rub their back up and down firmly, and this will encourage them to breathe. If that doesn't work, you can tilt the baby the other direction, like this, in the upright position, and this will open their airways, and keep rubbing their back. And then if you feel like the baby's gagging or turning blue, use your syringe in the mouth and the nose. Do the mouth first, then the nose. And then if that doesn't work, you can perform infant CPR, which is NPR. And how would you do that? You don't need to do chest compressions on a baby. Don't do that first. So you'll just put your mouth over both their nose and their mouth. And then you can breathe into them 4 or 5 times and see if that helps. Don't do chest compressions right away. Just breathe first to see if that helps. And hopefully by this time, first responders have gotten there. But if they haven't and that doesn't work, then you can do chest compressions just really softly and say a prayer, and hopefully everything will be fine. But like I said, they're still getting lots of oxygen from the placenta if you haven't cut it yet, so that's really good. Okay, so do you guys all know what a placenta is? Gentlemen, okay, we have a few no's. Okay, a placenta is an organ that it only grows, it only exists during pregnancy. So when a woman gets pregnant, she'll grow a baby and a placenta at the same time. So the placenta, it's an organ. And this side of the placenta, it's got all the vessels and the blood on it. And then the other side is where it attaches to the inside of the mother's uterus. So this is what it looks like. If you haven't seen one, you can see all the pretty veins. It actually has the nickname, the Tree of Life. It's really pretty, it's beautiful. So after the baby's born, within, it might be 5 minutes, it might be 30, it might be an hour, the placenta will be born, and you can tell that the placenta's gonna come because there'll be a gush of blood before it comes. And then the mom might feel like she needs to push, or you can ask her to push if you feel it's coming. But don't pull on the umbilical cord. You don't want to create any tension. Like I said, umbilical cords are strong, but they can break, and that would be really bad if you pulled on it and it broke. So just let the placenta come out all by itself. You can get your bowl ready to catch the placenta, and then after the placenta comes out, there'll still be lots of fluid, lots of blood coming out. That's normal. If you feel like she's bleeding too much, encourage her to breastfeed, and this will help to create more contractions, which will help to shrink her uterus really fast. And you can rub on her abdomen. It'll be right around her belly button and lower. Just push firmly, and this will help her uterus to shrink. It'll feel kind of like a softball. So just push on it and encourage it to shrink down. That's really good. And I know this sounds weird, but this is an emergency type of situation. So if she's bleeding a lot and you feel like this is too much, I know that she shouldn't be bleeding this much, you can actually cut part of the placenta off and put it in her cheek, and that will help shrink her uterus even more and encourage the bleeding to stop. So I know it sounds gross, but this is an emergency. Gross went out the window a long time ago. Don't be afraid to do that. It's very sanitary. It's not gonna make her sick or anything. I mean, it might like gross her out, but it's not unhealthy. Okay, that's the end.